So that's a great question. And so my answer is this. Philanthropy will continue to play a very significant role in healthcare delivery, even more so with the passage of the Patient Protection and Accountable Care Act, Obamacare. Why? Because the needs for healthcare philanthropy are not going away. In fact, philanthropy is likely to be even more important in the years to come as hospitals try to meet the increase for demand in healthcare services. Listen, healthcare reform may have addressed one component supported by healthcare philanthropy, and we talked about that, charity care. But our mission as professional healthcare fundraisers is to continue to point out that no matter what changes with healthcare reform and how it develops in the United States, the need for healthcare philanthropy is not lessening. It's not going away. We've already seen there are many new challenges that have surfaced as a result of the law. And the need for philanthropic investment is pretty clear in the areas of care coordination, in the areas of technology, in the areas of emergency room visit increases, continued primary care, physician shortages, nurse shortages, etc. The needs are very clear for philanthropy. You know, let's look at the emphasis on primary care doctors. Increasing the number of primary care doctors will keep people healthier and should ultimately reduce the number of primary specialty or specialty care procedures, expensive specialty care procedures. Ultimately, the shortage from primary care physicians, the shortage for nurses, the shortage for other medical specialties, it's coming at a time when our healthcare systems urgently need more doctors, they need more nurses, and traditional sources of funding for training primary care doctors, future nurses, graduate medical education, this is being noticeably reduced. The funding for these training programs and these education programs are being reduced. You know, okay, yes, there are some federal funds for training doctors in a patient-centered medical home model. However, significant funding gaps for training still exist. Private donors can have an impact on this. They can make sure through their philanthropy that primary care physicians are trained and available to serve their communities. Let's look at technology. You know, one of the goals of the Accountable Care Act was greater integration and greater linkages for physicians and nursing homes to combine together their technology and combine patient health information across specialties and across facilities. So putting this technology into operation and integrating it into new and existing healthcare networks, it's pricey. We talked about that earlier. Technology is pricey. So private funding can make a significant difference for hospitals, particularly small and rural hospitals, those that you represent. You want to keep up with, your hospitals want to keep up with the rapid changes of technology, but it's expensive. Private donors can continue to make gifts for the necessary capital improvements, equipment purchases, plant maintenance, and supportive care programs that benefit patients and benefit the community. These important programs can no longer be funded from shrinking operating margins. Our hospitals have shrinking operating margins. Our current nonprofit hospitals must respond to their aging infrastructure, their aging buildings, their aging population in the communities they serve, and the community's demand for improved or increased technology and services. Nonprofit hospitals still need to cover the cost of the underinsured, as well as meet the demands for services and for advanced technologies. So hospital margins are shrinking, they're getting thinner and thinner, and there's less money to invest in themselves and less money to invest into the community. So yes, nonprofit hospitals must continue to raise money and continue to try to provide the best possible care possible, and philanthropy will help make that happen. And so yes, the public needs to expect transparency. Yes, the public needs to expect greater financial management and reporting from our hospitals, but we also have to look at the changes in the political and economic landscape and talk about the pressures for hospital fundraisers that are put on hospital fundraisers to seek philanthropy and philanthropic investment. So, good question, and you asked a very good question. And so my answer is this: nonprofit hospitals, they strengthen communities, they strengthen individuals, they strengthen and promote the wellness in our own communities, and regardless of the passage of the Patient Protection Act and the Affordable Care Act, Obamacare, as you called it, the need for healthcare philanthropy and philanthropic investment is greater than it has ever been, and we need to continue to go out and share that message with our communities. So thank you. Are there any other questions?